Council of Louisville, and I have with me Leanne French, who's with the Department of Health and Wellness with the City of Louisville.
Right.
And we just had finished the program, actually full training for not CPR, but it was QPR, question, persuade, and refer.
Yeah.
So this is about suicide prevention.
Yes.
So tell me, why are we even talking about this?
So last week was National Suicide Prevention Week, and Louisville Department of Public Health and Wellness, Humana, a lot of public and private sector folks got together and said, what could we do that would begin to effectively eliminate suicide? Obviously for our city, for the state, for the country. And they found a program called QPR. Evidence-based, data-driven, we love all those words. And QPR trains people to be gatekeepers, people like this group. And the way we do that is we talk to people about what are some myths and facts, what are some things you need to know, but then we really focus on helping them create a toolkit, right? So that they can be effective action takers. And that toolkit enables people to know what to watch for and what to listen for that might be signs to let them know they need to take action. And then how do you ask the hard questions? It could be something as simple as, are you feeling okay? Or how are you doing? Or whatever, all the way to the really hard question, which is, are you thinking about killing yourself? Then going from that, depending on where the person is, relationally to, wow, I would really like to help you get some help. Is it okay if I work with you on that? And here are some things we might do. Here are some resources locally, which is the R for resources. So we talk to people, they get to practice doing QPR, and we then give them, so they're equipped with what to watch for, what to listen for, how to question, how to persuade, how to refer, how to lean into the relationship that you have with the person so that you lead people to safety and support that they need to take care of themselves.
Well, and what was helpful about it, so we even had these little helpful sheets, and they were, we did basically we played a role, right? We did role play. So we went through and did that, and I think even going through and asking those questions, you had us all state them out loud a couple times at one point, makes it a little more natural. It's still challenging, but I think really the point was, it doesn't matter how you get there, but you have to ask the question.
Absolutely, yes.
Because some of the myths that we talked about were the fact that that you can't stop somebody if they're thinking about it, or that you can't really be of help, or there's nowhere to go. I mean, there is a path.
And you want to be a trained counselor, which is the whole idea of training gatekeepers so that they can take some action to prevent it.
So clarifying, you said we don't have to be a trained counselor. I'm not a counselor, you're not a counselor.
I'm not a counselor.
But we have the ability to connect with somebody just a little bit, pay attention, and then get them somewhere, refer them somewhere that can help them.
Absolutely.
So you also referred to it as kind of a net. So,
yeah.
And the idea that actually in Louisville, the objective is to get to the point where there's zero suicide.
Absolutely.
We talked about stats, that suicide has been increasing or decreasing lately?
Increasing. Since 1999, in almost every state, suicide has increased.
Right, and especially young.
Yes, especially
16 to 24?
14 to 24.
14 to 24. So, and that's an impactful age, it's a challenging age, but people have to be paying attention. So you talked about creating a net.
Right. So the idea is that if you think about a net, if you've got more people trained, more of those connecting points on the net, the holes are smaller, so it's harder for people to fall through. And so we've trained thousands of people in Louisville in the last 10 days, in effect, and that means more and more people will know what to look for, how to question, how to persuade, and how to refer.
And so I'm an employer, and I am interested, because this training is free.
Absolutely.
It took us an hour and a half,
right.
That was it. And you want to do it for everybody.
Absolutely.
So where should somebody turn if they want to schedule some training?
a good place to start, people can contact me at Public Health and Wellness, and that number is 574-6222. That's probably the easiest way, and I'll make connections from there.
But there's also like a website, obviously,
Yes.
Louisville.
Louisville, I need to get it.
I was going to say even just the regular Louisville Metro Health website.
So here is Louisville Zero Suicide at gmail.com.
All right, so if you're interested, and everybody should be, because it was easy and it's helpful, make sure to contact. So sorry that you missed this morning if you did, but we'll look forward to seeing you the next time. We're always here, Baptist East Milestone, the third Thursday of each month. Thank you.